Well, for people experiencing hair loss, there is a new treatment on the market. It is less invasive than hair transplant procedures and could someday become the gold standard. Eyewitness News anchor Ilona Carson takes a closer look at stem cell therapy.
The idea that this procedure could spark new hair growth has breathed new life into the race to clone hair, and that may be just the beginning. Arlene Johnson has been losing hair for years now, and she's hoping to turn back the clock.
It was taking me like 20-30 minutes to comb my hair and with products to make it look like I had more hair, and that is aggravating.
Her weapon of choice, what could be the future of cosmetic treatments, stem cell therapy.
The vials that we're using are a combination of the plasma and the A cell.
Hair loss specialist Dr. Daniel McGrath is hoping to jumpstart the stem cells in Arlene's hair follicles.
Typically with female patients that have female pattern hair loss, thinning that they can't do anything about, and they get some thickening and regeneration of their hair. That's huge.
Here's how it works. A small amount of the patient's blood is taken, and the platelet-rich plasma is separated out. That is mixed with a wound-healing powder called A-cell and injected back into the scalp. Arlene's head has been numbed, so she doesn't feel a thing. Finally, the doctor uses some massage and small needles to create tiny wounds, which help trigger a healing response. What sort of results have you been seeing?
The results we've seen thus far, not only in my practice, but in colleagues that I'm close with across the country, has been better than 80% regrowth of hair or regeneration of hair across the board with our patients.
Check out these before and after pictures. This sort of therapy is being tested for a host of cosmetic uses, from plumping lips to firming sagging skin, even breast enhancement. As for Arlene,
I don't want to look 60 or 50 or 40. I just want to look as good as I can for my age.
So the big question, how much does this cost? About $3,500 for a treatment, but Arlene says it'll be money well spent if it works. We'll check back in about 6 months to see her results. Ilona Carson, 13 Eyewitness News.
No. We said Kelty Colleen.
Here we go. It doesn't hurt. That was my first vial. I felt it.
First the fangs, the needle, and then fast, arm up, so I don't faint.
Secretly, I didn't want to tell the doctor because I wanted to act like I was really courageous, but I almost passed out for sure.
You okay now? You want to tilt you back a bit?
No, I'm good.
It does help.
I'm good.
Okay.
Dr. Ackerman of Newport Beach spins my blood to make the vampire serum. In med speak, it's platelet-rich plasma.
PRP is a wonderful thing. It's been around for a bit, been used in various indications. Now we use it to make people look more beautiful.
The blood is coming. Kim's always colorful, but the blood is actually clear for the true vampire facelift.
Now in your particular case, we're treating very small area, little hollowness right through there.
Okay.
So you don't need that much. Same thing on this side. You ready? Yep. Just for a second.
One drop, one injection, and an almost instant lift.
Do I have fangs now?
So I know what you guys were thinking. Did it hurt?
And to be honest, little pinpricks. It was doable.
actually, I was thinking, what about steam and moisturizer? What happened to the good old days?
No, that had to hurt. Come on, Kelty. Great stuff. And next time we find something insane to do, we will send you again. No. We said Kelty Colleen.
Here we go. It doesn't hurt. That was my first vial. I felt it.
First the fangs, the needle, and then fast, arm up, so I don't faint.
Secretly, I didn't want to tell the doctor because I wanted to act like I was really courageous, but I almost passed out for sure.
You okay now? You want to tilt you back a bit?
No, I'm
it
good.
It does help.
I'm good.
Okay.
Dr. Ackerman of Newport Beach spins my blood to make the vampire serum. In MedSpeak, it's platelet-rich plasma.
PRP is a wonderful thing. It's been around for a bit, been used in various indications. Now we use it to make people look more beautiful.
The blood is coming. Kim's always colorful, but the blood is actually clear for the true vampire facelift.
Now, in your particular case, we're treating very small area, little hollowness right through there.
Okay.
So you don't need that much. Same thing on this side. You ready? Yep. Just for a second.
One drop, one injection, and an almost instant lift.
Do I have fangs now?
So I know what you guys were thinking. Did it hurt? And to be honest, little pinpricks. It was doable.
Actually, I was thinking, what about steam and moisturizer? What happened to the good old days?
No, that had to hurt. Come on, Kelty. Great stuff. And next time we find something insane to do, we will send you again.
Well, now there's a new procedure injecting people's blood components into their face.
Exactly right.
Tell us about this.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons. And what you do is exactly what you said, Travis. You draw the patient's own blood, you spin it, you separate the solid components, fibrin and platelets, from the other components. You take that fibrin and platelets and you inject it into wrinkles in your face, typically nasolabial line.
Like a self-filler, right?
And it is, and why that is, if you remember in your physiology and wound healing that platelets and fibrin form a matrix, and the collagen grows around that matrix. The other thing is that these products actually incite a growth factor release. So these would be the areas typically where we would want to inject these fillers. It's a little different. It's different than collagen. It's different than hyaluronic acid. But actually, they're getting pretty good results with it.
Are you using it yet?
I have not tried this yet. I mean,
Jim?
Give it a shot. You don't mean personally on my face. No, not yet.
I was just trying to get a sense for how common this is across
the country. But it's similar. When we
now.
take fat, we spin it to separate it,
Now,
make
how
sure.
long does it last? Does it get a reaction, or does it actually last?
Well, you get about a year. So again, it's not permanent.
But those other fillers aren't permanent either, right?
No, right.
Well, and it may be a good thing it's not permanent because what if you don't like it?
So, same deal that you want to inject these intradermally, and what they're doing, that they will stimulate a growth of your own collagen. That's the idea, creating a matrix. Good stuff, interesting idea out of Manhattan Ioneer, my old stomping grounds.
I think that this type of therapy is going to become more and more common for a whole host of problems because you're using your own components.
Tissue. You're not using synthesized manufactured products. Let's take a look and see how this works. These were done by Dr. Sclafani. He was nice enough to share these with us, but you can see the improvement, the filling of the nasolabial lines, corner of mouth.
Wow.
Early results. The great thing is, all natural. It's all you, baby.
Don't do it at home.
No.
I don't want people
Don't do it in your garage.
There's definitely an art to all of these fillers and things, right?
Yes.
Restore energy and start living your life again. It can all be possible with the help of bioidentical hormone replacement. And with me this morning is George Thompson. He's with Total Med Solutions, and he brought along with him patient Jim Reynolds, who's here to share with us his story about bioidentical hormone therapy and how it improved his life. Gentlemen, good morning to you. George, always good to see you. I want you to remind our viewers exactly why people may need bioidentical hormone replacement.
Well, sure. Once you reach age 30, your testosterone levels start to decrease, and they'll decrease anywhere from 1 to 5% a year every single year thereafter. So we treat our patients with bioidentical hormone replacement, which is a natural testosterone from the soy plant, and it gives you energy, makes you feel 10, 20, 30 years younger, more mental focus, more clarity, sleep better at night. It just changes your life for the better.
Okay, so all of that information entices so many people to pick up the phone and call you like it did Jim. So you're currently a patient with Total Med Solutions. What's your story?
I came to Total Med Solutions about 6 months ago and was apprehensive at first.
Sure.
Didn't know exactly what to expect. But what I found in the beginning was a great organization that has a team that is just unbelievable. Dr. Ellen, so thorough, so caring, and the rest of the staff just so helpful. What I really experienced from the very get-go took about 2 to 3 weeks for it to begin, but was a new vitalization of energy. Just more energy than I had had in forever. Clarity of thinking. Total recall from conversations from 2 weeks ago to 2 years ago to 2 minutes ago to even what I had for dinner last night. And at 66, that is something that's kind of new for me at this time. As you age, these things slow down.
Yeah.
I also experienced weight loss. 40 pounds over about 4.5 months, and I wish that I could say I was very diligent and exercised and watched everything that I eat. I didn't. It just happened. The energy that your body is putting forth is being spent, the metabolism speeds up. I've just kind of continued on with what my lifestyle has began to be back 5 months ago, and it has just been phenomenal. Some of the other things that I've experienced is a whole new revitalization in practically every area. A lot of my friends have come to me and said, Jim, you know, I see a difference in you. And there is a difference. The thing that a lot of them have said is, how much does this cost? You know what, I can honestly look at them and say, you know what, it has not cost me anything. It has made me money.
Wow.
The energy, the strength, the stamina, the competence.
I mean, this is an unbelievable testimonial, George. I can see you brought, wow, I can see why you brought Jim. And obviously his story is like so many others that seek treatment. And this is very typical, isn't it?
It is. The people that I've talked to asked me, they said, you know, the cost, Jim, what about it? And I said, you know, I've been smoking for 40 years. In the last 3 weeks, I've cut down 90%. And when you're talking about smoking 2.5 packs a day for 40 years and the cost of cigarettes today, I've more than covered the cost just on the quitting smoking. My wife has also done the same.
Wow. Wow. I mean, that is a big deal. And obviously, not only is your overall health and wellness better, but you're kicking some really bad habits. And George, final thought on this.
Yeah. Well, you know, look, the fact of the matter is, when you have a program that can make you feel like you're 20 years old again, and the way that it works is real simple. We're bringing your levels back to where you were when you were 20. So that's why you have all the energy. That's why you can eat, drink, and do the things that you used to do when you're 20 years old and recover quicker. So that's changing people's lives.
It's changing people's lives. And I know you have a very special offer for GMT viewers. If they go to TotalMedSolutions.com/GMT and they fill out this quick questionnaire, they can they're getting a discount. Is
they get
right?
a $50 gift certificate.
$50 gift certificate towards changing their lives, like Jim. Really big deal. The number again is 214-987-9200. Gentlemen, thank you so much. Jim, thanks for sharing your story. And over to you, Carrie.